both your arms forward for me. Sit upright. Can you... So, do you plan on competing this year?
Not this year, no.
What's up everybody, Dr. Ranen here. Today we have Nicole with us. Nicole is an ex-professional rugby player from the UK. She's currently playing amateur rugby in Dubai as well as amateur bodybuilding. Today she comes in with right-sided shoulder pain, which is presenting like an impingement syndrome. She's having difficulty in shoulder pressing, bench pressing, pretty much raising the arm over the head. So we're gonna assess her, see what's going on and see what treatment we can provide for her. All right, let's get both your arms forward for me. Sit upright. Can you lift up for me, please? As far as you can go. Any pain here?
It's actually okay here.
It's okay. All right, down for me, please. All right, let's get the left arm to the side and up for me, as high as you can go.
No pain.
Great, and down.
Just a bit tight.
This side.
Oh, that's painful from here.
Painful already.
Yeah.
And up for me.
Now I can't get it any higher than this.
You can't get any higher than that.
No.
All right, relax for me. Okay, let's get your both arms in for me. Here, let's get you to turn out.
That, yeah, on my right side is really painful.
Okay, now what we're going to do is let's get you to try and touch your shoulder blade with the left hand, please.
Like above here?
Underneath,
Behind.
yes, there we go.
Yeah,
Good?
yeah.
All right, relax for me. Let's try and do the opposite. You have to struggle to get there.
That is
Any discomfort?
all through the front here.
All through the front of the shoulder. Okay, relax for me. All right. You can leave your arms loose. Let me move it now. Any pain when I do that?
No, it's okay.
It's okay. All right.
Oh,
It's crunching.
no pain. No pain.
You can get all the way up.
Yeah.
Yeah? Okay.
Oh, that's a bit sore there.
As I come down. Okay. Leave your arm loose. Better?
This is through the bicep.
Through the bicep. Okay. All right. And if I move your arm, how's that? Much better?
Yeah, no pain.
No pain. Okay. All right. Let's do some orthopedic tests. So your active range of motion is limited in abduction, okay? That's when you do it. Active range of motion is when you do the movement. Passive range of motion is when I do it. The difference is in active, you're using the joint and the muscle.
Right.
When I do it, I'm doing the job of the muscle, so we're testing the joint.
Right.
Okay? If it improves, that means something's happening in the, there's a problem in the joint, right? Okay? Because I'm doing the job of...
The joint of the muscle.
Sorry, the muscle, my apologies.
Yeah.
Okay?
Yeah, so it's a problem with the muscle.
Yes, correct.
Okay.
Okay. Any pain in there?
Yeah, through the bicep.
Through the bicep, all right. Let's try this side. Relax for me. Any pain in there? Sensitive.
The whole way through.
The whole way through.
Yeah.
Okay, so that's your impingement test. Now we're going to do a speeds test just to check the bicep out. All right, hold for me. All right, just keep your arm in that position, push up.
I'm not very strong.
Any pain? Or just feels weak?
Just weak.
All right, here, hold for me, push up. Weakness or pain?
Both.
Both,
Yeah.
okay.
Yeah.
Make a fist for me, please. And then turn your thumb down. So this is an O'Brien's test for a labral issue. Push up. Any pain?
A little bit in the bicep.
Okay. Here, make a fist for me. Thumb down. Push up. Any pain?
In the bicep.
In the bicep.
Yeah.
Okay.
And I
Let's
think
just-
my traps are tight.
Tight. Okay, we'll have a look at the neck in a second. All right, push up for me, please. Good. Relax. Push up for me. Good. Relax. Push down. Good. Relax. All right. Push back for me. Go, go, go. Good. Push back for me. Go.
It's a little bit tender,
Out.
but it's all right.
Hold for me. Push back. Good. All right. Push your wrist back towards me.
No strength.
Good. Make a fist. Go in for me, please. Good. All right. Bring your wrist in. Push up for me. Good. Relax. Hold here. Push out. Good. So that's your supraspinal, okay?
Okay.
So that's your non-affected side. Let's try the affected side now. Push up for me. Any pain?
It's all right.
Okay. Push up. Any pain?
No pain.
Okay. Push down. No, okay, relax. Let's try the tricep. Extend for me. Sensitive? Mm-hmm. Yeah. Push back. It's a little weak, eh? Any pain or just weak?
I don't even know.
Sit
Let's
up for me. Let's try one more time. When you're ready. All right, let's go.
just weak.
Just weak. Okay. Make a fist. All right. Push back for me.
No shooting pain through my delt and bicep.
Through
at
your
the
delt?
back. At the back.
At the back, yeah. Okay.
Yeah, rear delt and bicep.
Come up. Push back for me. Feels weak?
Yeah,
Okay.
feels like I've got nothing.
All right.
Oh, even there, just shooting through it.
All right. Make a fist for me. Push your wrist back towards me.
Oh,
Oh, painful?
yeah.
All right. Make a fist. Hold there for me. Push out, please. Any pain?
It's all right.
Try again.
A little
too
bit,
bad.
yeah.
Okay.
It's just bicep. Ooh,
Oh,
just bicep here.
Just bicep,
Even
okay.
holding it like this.
all right. Push up for me.
Oh, no,
weak.
no.
No, can't do it.
No.
All right. Let's have a look at the neck.
Oh,
Sensitive?
just
Yeah.
so tight.
Tight.
Oh my God.
Sensitive? Okay.
Yeah.
Sit up for me. Okay. Any discomfort there?
No,
Okay. Any discomfort there?
no.
Relax for me. Any discomfort here?
Just tight.
Just tight. All right. Any discomfort there?
Just tightness.
Just tightness. Okay. Any discomfort?
No, it's all right.
No. Any discomfort?
Just tight.
Any discomfort here?
No,
No.
just tight.
Okay. All right. What I'd like you to do is, we want to test the supraspinatus out. Okay, bring your hand over, hold for me. Can you lift up? Any pain? No? Okay, hold for me. Slowly push up. Any pain? No. Okay, relax. Sensitive?
The whole body's tight.
Lift up for me. Any pain?
That's all right.
It's okay. Hold. Okay, push up. Any pain?
It's all right.
It's okay?
Yeah, it's all
all right. Okay. Let's get you on your back for me, please. All right. Push your hand towards your hip for me. Push in. Good. Relax. Push across for me, please. Push and relax. Pretty good. Push your hand towards your hip.
Oh,
Sensitive.
all through the front and the back, all through here.
All through. Okay.
Yeah.
So that is the lat. Let's get you to come up for me, please. Push across for me. Sensitive.
It's actually not too bad. It's
Not
just
too bad.
weak.
Just weak. Okay. So what actually happened was Nicole fell onto her shoulder. It wasn't actually a lifting injury. It was more a fall onto the shoulder, which triggered the shoulder pain. So I also want to test the stability of the shoulder. Okay. Any pain there?
No.
No?
No pain.
No pain?
Nope. No pain.
Nothing. Okay.
Just
Okay.
when you bring it back to here.
Just want to bring it back to here. Okay. Let's sit for me, please. All right. You can swing your legs over. Okay. So I'm going to speak directly to Nikki. All right. So we've obviously assessed you. We know that there's a difference between your active and passive range of motion. Something's happening in the muscle system, in particular, your ability to abduct. So abduction is deltoid and supraspinatus.
Okay.
In patients who have supraspinatus injuries, sometimes we actually find that they can push and do an isometric muscle test, which is contrary to what you would think, okay? Whether they're using other muscles to accommodate, I'm not too sure, but when we test the supraspinatus, it's fine. However, when I do my orthopedic test, it's sensitive. So there's definitely something going on there.
Okay.
All right. The deltoid is also sensitive, but these two muscles overlie each other. So if there's an injury to one, you're probably going to see some dysfunction in the other.
Okay.
All right. And the third thing is when you fall onto your shoulder, we want to assess the bicep. Okay. So when we do our speeds test and our O'Brien test, speeds test is for tendinitis of the bicep, and an O'Brien's test is for what we call a labral lesion, okay, which is basically when the long head of bicep tendon comes off its attachment in the shoulder. That test is also positive. Now, all these could be positive just because of the massive inflammatory response going on, or they could be an actual issue, one to the supraspinatus and two to the bicep. These two share the same inflammatory response, okay? So an injury to one is going to cause dysfunction in the other, right? What we're going to do with you today is I'm going to work on all the areas of dysfunction, the bicep, the supraspinatus, the delt, your traps, try and pull that shoulder into a better position, prevent it from rounding, your lat and your pec. We're going to fire up those muscles and retest your range of motion and see if it improves. Okay. If your abduction does not improve, they'll tell us it's definitely a structural issue.
Okay.
Then we'll need to send you off for an image and see what's going on. If it improves, fantastic. We'll give you some rehab, see how it feels. If it starts to go back after a few days, we'll still get you that image.
Okay. Perfect.
All right.
Perfect.
Okay, guys, we're going to take a small break, get Nicole changed, and then we'll be back with treatment. All right. All right, guys, so we're going to get into our treatment now. I'm going to fire up the muscles that are in dysfunction and are commonly associated with the shoulder impingement syndrome. We're going to start with the front of the chest and then and front of the arm, and then we're going to make our way to the back. Remember to subscribe. If you have any questions on shoulder impingement, please drop them in the comment section below, and I'll be more than happy to answer them. All right, so we're going to start off with the pec. What happens is when the shoulder rotator cuff muscles rather are not firing as they should, the pec and the lat take over. So The pec's going to be short and tight and pull the shoulder into sort of an anterior position. What I'm doing is desensitizing the pectoral nerve to release that muscle and allow the shoulder to go back into more neutral position. Okay, Nicole, you remember how this works?
Yeah.
We're going to start off nice and slow.
Okay.
You okay?
Mm-hmm. It's quite relaxing.
So, do you plan on competing this year?
Not this year, no. I'm planning to lose some of the weight that I'd gained, and
Yeah.
then I'm going to go into a long off season.
And you won a competition last year.
Yeah, I won bikini in WNBF in Dubai.
Nice.
Very good.
And did that give you a qualification or invitation to any other events? Because you did compete in the UK, right?
Yeah, I compete in the UK, but it qualified me to just compete in the pro show for WNBF.
Nice. And when is that, or when was
No,
that?
it was the same day. And
Ah.
I came third.
Oh, nice.
Quite good.
Congrats.
Thanks.
That's very similar to this guy. I think they're calling him Neckzilla. Do you know that guy?
No, but it's a great name.
He's got massive quads and a thick neck. He competed in his first pro competition, and then he won a pro card and competed in the and I think he also placed second or third.
Amazing.
Against Samson Duda. So
Love that.
yeah.
I think I just needed to be more conditioned for the show, and then I would have
Well, nothing like experience, right?
exactly.
Okay, so for those of you wanting to know what I'm doing in the trap, there's a small nerve that passes through the front of the trap called the supraclavicular nerve, and this is responsible for pain at the front of the shoulder, or component of pain at the front of the shoulder. So although Nicole is here for a specific issue or an injury, pain is a major part of that. So even if I can't fix the injury today, I want to reduce the pain. How's that? Still relaxing? Or a little bit different? It goes very fast. It goes very fast from relaxing to uncomfortable.
I can feel it in both traps. Don't know how. But my traps are always
Tight.
yeah. I don't mind though, it makes them look bigger.
All right. So the next nerve that we're going to work on is the dorsal scapular nerve. The dorsal scapular nerve supplies your traps and rhomboids, which are your scapular stabilizing muscles. So whenever you have a shoulder issue, you got to work on the scapular stabilizing muscles. That's what's going to pull the shoulder into a good position and offload any injury that may be causing the shoulder impingement. You okay? Mm-hmm. There we go. So if you look down here, you'll see, even though I'm stimulating here, I'm very close to the nerve that's supplying these muscles down here. So here we go. That's a trap and rhomboid that's firing up. Okay. All right. So next thing we need to work on is your lats. Now, you don't like this position. but we're
Oh,
gonna
and
bring
that's
this
so
arm.
tight as well.
Yep. Let's bring that up. Just rest there for a second. Okay. You good?
Mm-hmm.
Okay. Let's bring this back down here. You good?
Mm-hmm.
All right. So now we're going to work on the bicep. So you're just gonna turn your palm out for me. Feel the bicep, and we're gonna go about 2 centimeters down. And this is where we will find the musculocutaneous nerve that supplies the bicep. You okay?
Mm-hmm.
All right, we're just gonna leave that one in there. We're gonna come across here and we're going to work on the tricep. So, you can keep your arm in that position. Is that okay?
Mm-hmm.
All right. So, you okay?
Mm-hmm.
So, the tricep is not part of the rotator cuff, but it's the antagonist to the bicep.
Mm-hmm.
This means that it's the pair of the bicep muscle. So because you're getting some dysfunction in there, I want to work the tricep as well. This is going to improve the pulley system between the two muscles and maybe offload the bicep a little more. All right, so here we're going to go for the axillary nerve. You may feel a twitch here. Okay. You good?
Mm-hmm.
All right, and we're going to do one into the deltoid. So I can hear, oh, you felt a twitch? There we go. Got 2 more to do. So we have got supraspinatus. Oh, you felt a twitch?
Felt that all the way through my hamstring.
There we go. Oh, all the way through your hamstring.
Yeah,
Damn.
like you know, like a shiver.
Yeah.
Yeah.
And we've got infraspinatus right here. There we go. Oops. Last one. Are your hands sweating by any chance?
Probably. No,
Okay.
it's
They're not. Okay. There we go. Okay. So I'm gonna get that from you. Try keep your arm rested in that position for me, please. Okay guys, now the cables come out. So we've worked on quite a few muscles, worked on firing them up. Now we've got to work on keeping them switched on. So here we have our deltoid. So at the same time, I'm also doing the auxiliary nerve, which supplies teres minor, which is one of the rotator cuff muscles. Then we've got infraspinatus, supraspinatus, tricep, and bicep. Okay. We will work on subscapularis in a bit, in a different position. Okay, so let's get going. We'll start very slow. How's that?
great.
Any of them too strong?
The one, well, it's not that it's too strong, but the strongest is, I think, either in my tricep or my bicep.
This one here?
Okay. Lower.
Here?
Yeah.
Okay, so that's blue. How's that? Better?
The one in my back is pretty strong.
This one?
Whatever.
How's that?
Just all of them feel.
Okay, what we're going to do is we will just move them slightly. This one here will need to come over. All right. Okay, so we will just move this needle. Get that out. Change the position. You don't do too bad with needles.
No, I'm not looking.
Okay, that's most people, I guess. How's that? Any change?
Shoulder, back, pulsating.
Okay. Can I increase or shall I leave it?
You can't. What is it? What? How much are you supposed to increase?
So
by?
we essentially, it needs to be mild.
This mild. Ooh.
This is mild. I'll go down one.
Yeah.
How's that?
Ooh.
I'll go down another one. I'll go down another one. How's that? Okay, we'll just keep it there. We'll let this run for 5 minutes and then we'll work on the other muscles. We'll reassess and then we'll work on the rest of the muscles. Okay?
What is this doing?
Good question. So, some of the needles are near nerves that supply sensitivity or pain to the shoulder. Some of the needles are in areas that nerves are passing that supply specific muscles. Some of the needles, like this one here, does two roles. It's stimulating the axillary nerve, which supplies muscles and sensitivity to the shoulder. So I'm using the TENS current which does two things: stimulate muscle function and reduce pain. I'm using that current to pass through the needle.
Turn it down, sorry.
Sure. To pass through the needle and then through the muscle and nerve to bring about that response. How's that? Too strong? It's okay? All right. How's this one at the back here?
I can't feel it in comparison to the one on my bicep, or the tricep. I can't. It's my whole arm that is the strongest.
Okay, you have 3 minutes left.
No way.
Yeah.
Is it supposed to be causing a lot of pain?
No, it can be uncomfortable though. You have less than a minute to go.
Okay, I'm gonna just try and get through it.
Okay guys, while Nicole is finishing up there, let's explain shoulder impingement syndrome. Shoulder impingement or subacromial impingement is compression of the tendons and or other structures in the shoulder joint. What happens is this bone, the humeral head, starts to impinge on the structures passing through the space called the subacromial space. Here you have your rotator cuff tendon, your tendon of the supraspinatus, infraspinatus, teres minor, and subscapularis passing through. You also have the bursa, which is a sac of fluid that sits on the tendons and prevents the tendons from hitting the bone. Okay, so you can have an irritation of the tendons, you can have an irritation of the bursa, you can have a change in shape of the acromion. This is what we call acromial morphology. Or you can have a muscular imbalance which is causing the humeral head to be unstable, that creates an irritation of those structures. This is what separates a structural impingement syndrome from a functional impingement syndrome. Let's get back to Nicole. Right. Are you alive?
Oh, did you just put one into my trap?
No, I took it out.
Oh, it's seized up.
1 second.
Oh my gosh.
So the electrostimulation was a bit too sensitive for Nicole, so we're just going to do some vibration therapy to try and reduce some of that sensitivity passing through the skin and the muscle. You'll notice that I'm moving from distal to proximal, so from my elbow up. The reason I'm doing this is I'm trying to push the pain sensation back to the spine where it can be dealt with more appropriately by the spinal cord and the brain.
Very relaxing.
As opposed to the needling, right?
Yeah.
Let's get you to relax there for a second. All right, so let's reassess you before we work on your mid-back muscles. You wanna come around? Let's get this in here. How's putting that in? A bit better?
Yeah, it wasn't painful.
It wasn't painful. Okay, let's get you to sit and face that way for me. To the side and up for me, please. Still stuck? You can keep going if you can.
No, that's really painful.
That's really painful.
Like, really, yeah.
Through there, okay.
Pain. I can get to here, but it's very painful.
Okay,
There's
so,
no pain,
all
but
right.
then it's like here.
Yeah, okay. Hold for me, please.
What we're doing more visuals.
Yeah, we're just gonna work your trap muscles and then we're gonna finish off with some manipulation, okay? All right, so let's work your trap mid. How's that? It's okay? Not too strong? Okay. All right, let's bring this arm up for me, please, under your hip. All right. You're just gonna raise your shoulder slightly. I'm gonna sneak my knee in there. Okay, leave your shoulder loose now. There we go. We'll get in here. And you are almost done. You okay? Great. Relax for me. Bring this arm down. Okay. Okay, you can give me that. All right, so what we'll do is we'll give you an opportunity to change and then we'll end with some manipulation. I'll just, give me a second. Just tie that for you.
Okay.
All right. Lift your head for me. All right, I got you. Inhale and exhale. Inhale and exhale. Last one, inhale and exhale. There we go. That was easy work. Let's get you to sit for me, please.
Cracked like Popcorn.
Yeah, you probably needed that.
Yeah.
Let's get you to lie on your back for me. Come back for me, please. That's perfect. Okay. Move your head loose. Move your head loose. You can close your eyes. Inhale and exhale all around. Good.
Yeah.
Let's do one more. Inhale and exhale.
Oh.
Okay. Let's get you up. All right. We're gonna do one more. You're gonna lie face down for me. Bring this right arm here. Left hand underneath your hip. All right. Turn your head to the left side for me.
This side?
Yeah, sorry. Yeah, this is your left side, yeah. All right, inhale and exhale. All the way out. Let me bend your head. There we go. You good?
Yeah.
All right. Let's get you to sit for me, please. All right. Let's get both your arms forward for me and up. How does that feel?
Pain free.
Okay, down for me. Right arm to the side and up. How's that?
I can do it. It's
Yeah.
still a little tender here.
Yes.
But I can still go all the way up.
Much better, that's
Yeah.
good. Okay. Let's do some muscle testing. Make a fist for me. Push out. Good. Up for me. This one was
See, this is a little bit uncomfortable.
uncomfortable,
Yeah.
okay? Make a fist and push up.
Yeah, that's
Painful?
Yeah.
Okay. Push back for me. Ooh, okay. Push back for me. That's better.
yeah.
All right.
That was better.
Let's try some of these bicep tests. Make a fist. Oh, sorry. Open your palm for me. All right. Push up. Any pain?
Better.
Better?
Yeah.
Okay. Make a fist. Let's come more into the midline. Thumb down for me. Push up. That's much stronger.
Yeah.
Yep. Okay. All right.
Great.
Okay, guys, that brings an end to our session today. We have some changes, not as much as we would like, but this is how it goes. We can't, unfortunately, fix everything all the time. So,
So,
yep.
better.
Nicole definitely has better range of motion, but obviously some discomfort. So we're going to probably send her through for a scan on the shoulder, check what's going on, what structurally is affected, which is causing her impingement and her shoulder pain. And we'll definitely let you know what's going on with her case in the future. All right, Nicole, would you like to let our loyal viewers know where they can find you on social media?
You guys can find me on Instagram at Nikki Cowell. So that's NIKKICOWELL.
All right. Thanks for following and watching, guys. Please make sure to hit the like button, subscribe, and hit the notification button. We'll see you soon.